Hi, I'm Victor Schoenbach. I'm sitting here with Dr. Cheryl Blackmore Prince in the Georgia World Conference Center in Atlanta at the 2017 APHA meeting, and we're going to be talking about her life and her work and her professional career and her plans. So Cheryl, I really appreciate you doing this interview with me.
Okay, thank you for asking me.
And I'd like to start with, where were you born? Who were your parents?
Okay, well, I was born in New York City in Queens, and my dad was a carpenter. The job that he retired from was for F.W. Woolworth, so he did more than just carpentry. He did a number of different things. And my mom was a secretary, but when I was growing up, she was able to be a stay-at-home mom, and she typed dissertation theses on a non-electric manual typewriter for doctoral students at NYU. She had a friend who was the secretary at NYU, and the graduate students were always looking for someone to help to type their work. And so I remember as a young child that she would do this while we were at school, and so then when we came home, she was there to be mom. And I remember going with her to turn in the dissertation theses to the students. I remember how she had to separate out the pages on an ironing board because there was no Xerox at that time, and you had carbon copies. And then when she would go to turn in her work to the doctoral students in Brooklyn, sometimes she would take us with her. And I recall thinking at that time I never wanted to go to graduate school. I never, especially didn't want to go after a PhD because those students looked crazed by that time, as we all did. And that had an impression on me for a number of years, but again, I was pretty young.
You mentioned your father was a carpenter, but you told me before that he was in the union, and that actually was not a bad job in terms of benefits and other things, which
right.
people might want to know about.
Right. I think when he got out of the war, he was in the Army, and his first job after the war, I believe, was for the post office. And then being in New York City, the City of New York sanitation department had good benefits. And so he got married after the war. And I remember going to get my health care in an organization called HIP. I don't remember what it is.
Health insurance
now.
plan.
Health insurance plan?
I think so. It was then. Anyway.
Yeah, so the sanitation department had great benefits. And then while he was working for them, he started doing the carpentry work. So he worked 2 jobs. And then when I was a little girl, and then at some point he gave up the city job, and some of his friends thought he was crazy to give that up because it had such good benefits. But he really liked to create, and he liked the carpentry work, and he'd gotten working with Woolworths, and he was able to retire at age 60 with 20 years at F.W. Woolworth. So he was in the Carpenters Union, and he had good health benefits with the union. And then after he passed, my mom had the Blue Cross Blue Shield, hit the benefits, so that was a good situation for him and for us growing up.
And what was your high school?
I went to Bishop Riley High School. I went to Catholic school from K to 12, St. Catherine of Siena in St. Albans, and then Bishop Riley High School in Fresh Meadows. Bishop Riley doesn't exist under that name anymore. It's been changed to St. Francis Prep.
Mm-hmm.
And then from there, I went to the State University of New York at Buffalo for nursing school.
Mm-hmm.
I knew I wanted to be a nurse from a little girl. I also knew I wanted to work in midwifery from a little girl. And my mother encouraged me. I remember she looked up schools of nursing and made sure I went to one that was accredited by the NLN, made sure that I went to a 4-year school. And then we eliminated all the schools in New York City because her recollection was that nursing students worked the night shift when they were hospital nurses. And that was true when she was growing up, but not so when I went to school. But she didn't want me to be having to be on the subways at night trying to get to a hospital when I was a nursing student. She wanted me to be on a campus. And I had a Regent Scholarship in New York, so that sort of narrowed down my choices to a New York State school or someplace that we could afford the tuition. I remember knowing the tuition restrictions, found that the University of Hawaii, way back then, with the tuition room and board was no more than it was going to be at the University of Buffalo. And I asked my mom if I could apply there, and she said, you can apply there, you can go there, but once we send you there, you cannot come home for 4 years because we can't afford the airfare. So I didn't apply there. The only place I applied was the University of Buffalo. There was a couple of other schools that just were out of financial range. I think University of Rochester was one. So
now you were a first-generation college student.
Absolutely, absolutely. Well,
I mean, you're
yes
the 2
and
years.
no. Yes and no. On my mother's side, she graduated high school and went to a business school. She was a stenographer, so she got that kind of training. She never was able to go to college because she had rheumatic fever. I knew my father. I did not know that he had no formal education until I got to college and found out because he was very literate. I didn't know that his formal education ended at 6th grade when he was in Georgia and he moved up to Philadelphia. Interesting, in recent years, I've been to some family reunions and I discovered that an uncle of my father's that I'm very familiar with, he used to do our accounting, he was an accountant. I didn't realize he had a master's degree. My father was born in 1915, so Uncle Rule lived until he was almost 100. He was born way before that. So he had gone to college in the 30s, I believe. I know his wife was a nurse, and I remember going to their house as a little girl, but I did not realize there was that much education on my father's side for the relatives that had left the South and moved to the North early on. Not so for my dad, but he did enter the military and did 4 years because World War II broke out while he was in. He did his 4 years and came out and was able to get good jobs. And he read the newspaper every night. He'd come home from work and he'd be sitting in his chair reading the newspaper or watching the baseball games. That's what I remember mostly. So after nursing school, I never was interested in public health in nursing school. I was always interested in hospital nursing and particularly wanted the maternity experience. Between my junior and senior year, I passed the board to be an LPN, came back to New York and worked in labor and delivery at NYU Medical Center.
What years? Can you give me the years?
1970. It was the summer of 1970.
So you started college?
I started college in 67, and I finished in 71.
Mm-hmm.
And it was in 1970 that I worked at NYU Medical Center, 70 and 71 in the summer. And I loved working in the hospital, but I got married in 71 and returned to Buffalo because my husband still had 2 more years of school to finish, and took a job at the visiting nurse service, basically for the pay and the hours, not because it was something that I loved. I'd done a rotation in the visiting nurse service as a student, and so I didn't mind the work, but that wasn't my love. So I did that for a year. I also pursued my interest in maternity by getting trained in Lamaze, so that I could teach prepared childbirth to pregnant women. And it was doing that as a second job where I met the person whose name I can't recall, but he and his wife, I was training them to have their baby. And he was at the Suicide Prevention Center in Buffalo, New York, and was in a position where he was looking to hire outreach teams. And he recruited me away from visiting nurse service to be an outreach worker where they, when the volunteers would assess someone as being potentially lethal or harmful to others, they would dispatch an outreach team, which would be a male and female, a paraprofessional and a professional, to go and see if we could intervene rather than dispatch the police, because the police only made paranoid people more paranoid. And so it was a really good service. I don't know if it's still in in place in Buffalo, New York. We worked with the Erie County Health Department in that way, and I did that for a year. And then went out to Denver on vacation to visit a college girlfriend. My husband and I went out to visit someone we were close friends with in college. She had moved from New York because her father got transferred while she was in school, and she'd had a chance to go out to Denver a few times and found that there was a world outside of New York City. And she would come back to school and tell us, you have to come, you have to come. So this particular summer, after I'd been in Buffalo 2 years, moved longer than I'd intended, we drove out to Colorado, and they were desperate for nurses, and my friend was going on an interview for a job, and so I went along with her, and I got a job too. And so I asked my husband, do you think you can, he had a few more credits to get, and I said, can you call back to the school and see if you can transfer your credits back to graduate? And so I called my job and gave them 4 weeks notice, and we went back, packed our stuff up, and moved to Denver. And that would have been 1973, the fall of 73. I got a job at the University of Colorado Med Center working in labor and delivery, finally. And I also worked in the obstetric clinic. We were ahead of our time. There were no nurse midwives allowed in Colorado at that time in 73. Nurses were, our team at this university hospital was trained to work with the clinic patients. There were very few private patients, but we had our clinic patients. And as a clinic patient, you were going to be seen by a resident and then delivered by a different resident, and there was no real continuity of care. But with the teams of nurses, we would pick up the patients at 20 weeks once they had come in and were assessed to be a normal patient. They weren't in dystocia or anything. We would follow them from 20 weeks to 36 weeks with their monthly visits, and they wouldn't see a physician at all. We would do all of their checks, give them health education and nutrition, and do everything with them, and then they would be re-examined at 36 weeks, and then we would continue to follow them weekly. When they came into the hospital, they would know who their nurses were, and then one of us would come in. I would work kind of like residents did. I'd work every other day during the week, 24 hours, and every other weekend I'd be on call, 72 hours. And if one of my patients came in when I was on call, then I was in for the long term. It was great for the patients. It was a little difficult for us as nurses because there weren't enough nurses on the labor deck, so that even if one of your patients wasn't in, there always had to be 2 nurses. They only would staff it with 1. And so you might be on call to help out the labor deck, and so often I get called in at 11 p.m. or 10 p.m. to come in to work the 11 to 7 shift, not because one of my patients was there, but because it was a lack of staffing. So that was a downer. Meantime, my girlfriend in public health, there was still a lack of nurses in public health. She was working Monday to Friday, 8 to 4:30, and she said, come on over to public health, plus they pay better. So you could be a public health nurse, it was required to have a bachelor's degree, and so I went ahead and interviewed for a job in 74, and actually got a job higher than what I interviewed for. They said, well, you've had several years of nursing since you graduated. You can come in as a public health nurse 3 in the role of a supervisor, and we want you to be the supervisor of the STD clinic. It wasn't a prevention training center yet.
Was this in Denver?
This was in Denver, and I really didn't know anything about VD it was called a VD clinic at the time. I had an hour of VD lectures in nursing school, so never been exposed to a VD patient and didn't know really anything about gonorrhea and syphilis. And so I went home, got my textbook out, brushed off, read up a few things before the interview, got the job, and I had a wonderful person to work with, Dr. Franklin Judson, who had just come to Denver that summer. He was a graduate of the EIS program at CDC. So he had a number of contacts at CDC. He knew about epidemiology, of course, and he turned our clinic around, where patients were given a lot more respect than in many other VD clinics. around the country. We were a patient-oriented clinic. And together, we made that clinic one of the model clinics that CDC had other people come to for training over the years. People like Paul Wiesner, who was the division director at the time, he came out to our clinic and he was impressed with what we were doing. We got some research funds through some of Frank's work, and he would support the continuing education of the staff and send us to conferences. We went to the VD National Conference, maybe just 2 people at a time. So I got a chance to meet other people at CDC over the years, and I made some contacts so that by the time I was ready to come to CDC, I knew a couple of people at CDC.
What do you mean by the time you were ready to come to CDC?
Well, a couple of things happened. During the time I was at the clinic from 74 to 79, I had 2 children, and I decided to go back and get my master's in maternity. It was parent-child nursing. They had a pediatric nurse practitioner, but that wasn't my interest. And they did not have women's health. They didn't have midwifery, so I took what I could get. And I started 9 months pregnant. My daughter got her master's during that time because she went to classes.
That was your practicum?
That was my practicum. She went to classes for 18 months. We went to class before labor, we went to class during labor. I took her to class when she was 5 days old. As she got older, she became the infant that we learned to do physical assessment on, because, I mean, she was just either in a snuggly or on my back or in a little car seat or something under the table. And once she started getting more vocal, I had to get a babysitter, but she was there whenever we needed to talk about babies. She was there. So I finished up in 77, and by that time I was pregnant with my son. And by 79, I realized I wanted more than what I was doing in the clinic, in the STD clinic, but I wasn't exactly sure what. And I got divorced, and I needed to move back to the East Coast so that my kids could be nearer my parents, who had retired and moved to a farm in Virginia. Well, I'm a New York City girl. I wasn't going to Virginia, but I needed to be a little bit closer. So I was exploring Atlanta, thinking I could work in the clinic in Atlanta. And on one of my exploration trips, I called CDC people that I knew and asked them about the difference between the Fulton County and the DeKalb County.